Hello, I am Dr. Stalin Ramprakash. I am one of the pediatric hematologist, oncologist and bone marrow transplant consultant working at Aster Hospitals, Bangalore. Today we will talk about bone marrow transplant. So bone marrow transplant is a medical procedure which is done to cure the patient of various blood disorders. Mostly they are serious life-threatening or life-limiting conditions, or they are genetic disorders for which there is no other treatment. So what is bone marrow transplant? So bone marrow transplant is a medical procedure where we remove the patient's own stem cells and we will give the stem cells from somebody else, which then they will go inside the patient's body and it will start working and start making the blood cells, which is red cells, white cells and platelets. And what are the conditions in which we do the bone marrow transplant? So bone marrow transplant is done for a variety of different conditions. So it can be for blood cancers like leukemia, which is not responding to the usual treatment. So in that situation, bone marrow transplant is the only curative option. Otherwise, the patients may not survive. And there are many genetic conditions, blood disorders like sickle cell disease, thalassemia. These are conditions which the patient is born with, and the current non-transplant treatment is only conservative, which means you just managing the situation. Usually the patient don't live a full lifespan, and the only curative treatment is bone marrow transplant. And if you ask how the bone marrow transplant is done, many people think this is a surgical procedure, some kind of operation. It is not a surgical procedure, it is a medical procedure. So what we do, we give some medicines in order to sort of kill off the patient's stem cells in the bone marrow, which are either defective or not working. And thereafter we collect the stem cells from the donor. So that is collected in few ways. Either it can collect directly from the bone marrow when it is called as a bone marrow transplant, or we give a little injections to the donor and then we can collect it through the blood, and which we call as a peripheral blood stem cell transplant. And some people call it as HSCT, hematopoietic stem cell transplant. All are same. And how it is done for the donor, it is not a serious procedure. We have to give some injections for 5 days for the donor and then collect the cells. It is a very simple procedure. And for the patient, usually there will be some investigations to find out about the patient condition, and then we will do some preparations. Sometimes we collect the patient's own stem cells and store it in case we need to reuse it again. And then we will give some medicines, what we call as a conditioning treatment, a combination of medications. So for that, the patient will get admitted in the bone marrow transplant unit. Usually they will stay somewhere between 45 days to 60 days in the bone marrow transplant unit, during which the medicines are given and the stem cells are given, and we wait for the stem cells to come back. And once the new cells have come back and the patient is okay, we discharge the patient. But most importantly, the patient have to stay within the vicinity of the hospital for another 3 months to make sure that everything is gone fine, because most of the complications post-transplant will happen in the first 3 months. And if things are very good, then most of the time 4 to 6 months after the transplant, patient will be able to go back to their place. And even then they will need long-term follow-up, which we can do it over sort of internet or sort of a video call kind of things, which we do normally for most of the international patients. So it is a life-saving procedure, and many patients without transplant, they don't live very long, or they don't have a normal life because of that original condition they come with.